Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Manish Thapar. He is a hepatologist, and he wrote the Kevin MD article, 2020 in Hindsight, What We Can Learn. Manish, welcome to the show.
Thank you. Thank you for having me on. It's an honor.
We'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Well, I have been in this country for more than 20 years, and I've been involved with medicine, as a resident and out of training since then. And for the past 10 years, I have been in Philadelphia area, and I've been working at academic centers and seen how medicine has changed, and that's where I am. I did not expect to be in a pandemic, but I am, as is everybody else.
So you are a liver specialist at an academic medical center. Tell me how the last year and how the pandemic is affecting the cases that you're seeing.
The pandemic has obviously taken a toll on patients. Patients have been exposed to COVID, and a lot of liver patients come in and they're likely to do poorly, especially if they're decompensated cirrhotics. The hospitals have been on surge. They were on surge or lockdown in the spring, and now there's definitely an element of delay in care where patients are not coming in for their appointments. There's also patients are still scared to come in. I frequently get emails or messages from patients saying, "Hey, listen, do I really need to go in and get these tests?" So and that's it's going on a year now, and so it has taken a toll on the patients. Certainly, it has also taken a toll on the providers who are providing the care.
So you mentioned that patients with cirrhosis, they're not going to do as well when they get infected with COVID-19. Now, what is it specifically about cirrhosis that makes that a poor prognostic indicator if they get admitted with COVID-19?
I'm talking mostly about patients who have decompensated cirrhotics. If they have ascites or renal failure, if they get COVID, it's another hit. And it's just prolonged recovery. They tend to do poorly. So it's a risk factor for doing poorly, although not as much talked about or researched into as other risk factors for COVID.
And one of the things you mentioned was that providers also weren't doing well during COVID-19. Can you explain more why that is?
I think part of it is that's what I write, the toll that the pandemic is taking on the providers. It's just starting to become apparent. It has taken a mental toll. Everybody is stressed. It's not easy wearing a mask, scrambling for a mask to start off. And I remember when this started, and there was obviously rationing of a surgical mask, and I was in the hospital. I sneezed in my mask. I had to go look for another mask. It's not a good, the system was not set up for this. And so it's the mental toll, it's the emotional toll on the providers. I have seen residents, number of them, between two hospitals that I work at who've been exposed to COVID. Yes, they're young. Yes, they're recovered, but I feel for the residents too.
Speaking of your article, let's transition into that. It's titled 2020 in Hindsight, What We Can Learn. Now, for those who didn't read that article, can you just walk my audience through it and share the story of why you decided to write it?
Looking at how healthcare systems, how the government, how everybody has reacted to the pandemic. Yes, it is very, medicine is, I believe, still is a very noble profession, and most of us do it to help other people. We call it a wartime effort right now, but nobody's looking at what you're doing and what actions have been taken to make this a successful effort. And I think hopefully with the vaccine, things will get better. It does not give a free pass to everybody who has had a chance to make decisions. We need to understand what decisions they made, why they made those decisions, and how you can make better decisions next time around, hopefully when this comes around. I think we will be doing a great disservice to ourselves, our patients, and our peers if we don't have a conversation. I think physicians they're busy and for various reasons are very uncomfortable in having these important conversations on where the direction of the healthcare system should be. So that's why I thought it's important to have something written.
Now, we're about 1 year into the pandemic, and 1 year into intermittent lockdowns, and we have situations with lack of PPE and everything that we've gone through. Now, what are some of the top things that you've learned over this past year during the pandemic?
I wanted to offer some constructive suggestions in my article, like a starting point. Hey, listen, this
Mm-hmm.
is what we ought to be doing. And I think one of the first things that I mentioned is this telehealth. Now, telehealth has been a boon for all of us, for patients. There's no reason that we should go back to anything less than full and complete coverage for telehealth.
Mm-hmm.
Then I talk about reform for malpractice,
Mm-hmm.
a reform for licensure. A lot of governors and have taken emergency powers from the pandemic and tried to say, okay, your license is going to be valid for 3 years. You don't need, they're waiving off all these requirements. It makes you question, why were these requirements there in the first place?
Mm-hmm.
Why can't a license be valid for 3 years? Why does it have to be 2 years?
Mm-hmm.
Why do we, I have licensure in two states and
Sure.
2 DEA licenses. It costs thousands of dollars to maintain. It doesn't make any sense. So we're really feeding on an industry which makes no sense. And as the pandemic has shown, it is really of no use. And lastly, I think the third thing that I mentioned in the article is healthcare organizations like JCO or OSHA, whatever you want to
Mm-hmm.
call them. They were missing. They were missing every rule, everything was thrown out of the window in a pandemic. And I'm not
Mm-hmm.
saying it should not have been, but it makes you question what is their role. And we need to really sit down, critically examine their role and see, okay, this is your role in healthcare. And we have to decide as a country, as physicians, how are we going to treat healthcare? How are we going to take care of the patients? How are we going to take care of the providers?
Now, you mentioned three things that you've learned over the past year that could use reform: telemedicine, licensure, and medical liability. Now, tell me about telemedicine. What's its role right now, and how are you using telemedicine?
I have been very fortunate. One of the health systems that I work at was a pioneer. They had been trying to pioneer telemedicine for the past 2 years. And I think within a few weeks, they were up to 70, 80%.
Mm-hmm.
But other places were not, they didn't have this on their radar. And they have picked up over the past year. The point I'm trying to make is, I think there was something introduced in the House to pass a comprehensive telehealth bill. I think that's the right way to go. I just think insurance companies need to continue paying for it
Mm-hmm.
at rates that they pay for an office visit. But in addition, for it to be successful, you need to do away with things like, where the patient's located and how EMRs are going to be required to cover it and what's the method of, with HIPAA compliance and things like that. So that whole thing has to be looked at and made sure it's there to stay.
Now, what about medical liability? What kind of reforms do you think needs to be done there?
Well, medical liability is I think it's too hot a topic for anybody to touch or do anything about. But I think from a purpose of a telemedicine standpoint, I think
Mm-hmm.
you have to go for the low hanging fruit. I am told that I have to be careful when I'm seeing a patient who is not in a state where I hold licensure, So
Okay.
if I see a new patient who is, let's say, in Washington State, right? I can't see it because I don't have a license in
Mm-hmm.
Washington. With telemedicine, you have to look into that and you have to try to reform that situation.
Going forward, what are some things that we individuals, physicians, can do to help make sure that telemedicine payments are enduring and make sure that interstate licensure is what you want? What are some things that we can do to help make those changes happen?
As physicians, we have to take out the time
Mm-hmm.
to talk to the stakeholders, right? Who are people who are making the decisions that this is what is needed. I think whatever organization you're a part of needs to start speaking up. Hey,
Mm-hmm.
listen, this is what's needed, and it's needed now. The analogy is this is a wartime effort, right?
Mm-hmm.
There's no reason why there's not availability of masks even a year later.
Mm-hmm.
How would you send off soldiers to the war without giving them battle gear a year later? There's no reason. And those are the things that need to say, okay, this is not going to happen. You got to produce the mask. I think you got to start speaking up and talk to your organizations, the societies, and make sure the voice is heard.
We're talking to Manish Thapar. He is a hepatologist, and he wrote the Kevin MD article, 2020 in Hindsight, What We Can Learn. Manish, we are speaking towards the end of January, and we're, like I said, 1 year into the pandemic. What do you anticipate the next 3 to 6 months to bring? And I guess from the suggestions that you recommended, whether it's telemedicine, medical liability, or licensure, do you see any movement in terms of those reforms in the near future?
I think the biggest thing that the physicians need to talk to and advocate for is reforming the medical licensure system. There was some movement. I think 25 states banded up and said, okay, there should be reciprocity of license, especially in contiguous states. If you share a border, there's no reason why physicians should be mandated to have a licensure in each individual state. They should be mandated to, accept each other's licensures on reciprocity. And ideally, you would have a national licensing system where you're not confined within the country to go anywhere and practice. I think that should probably be the next step. And then I think it's probably going to take a lot of pressure on the federal government to look at these licensing organizations, which deal with hospitals and healthcare systems, to assess their role from top to bottom. You got to look at them and see what they did and what they did not do, or what they could do better.
And my final question, do you have any take-home messages you want to leave with the Kevin MD audience?
The healthcare system is very complex in our country. Physicians and providers still play a key role. I would encourage everybody who reads to speak up. And if you like you say, if you see something, you say something. And that's the only way you can say, okay, this is how change is going to be made. Otherwise, the next time we have a situation such as right now, we will be in the same boat, if not worse.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you for having me. It's an honor.